Hi, I'm Dr. Frank Davis here again talking about the VA PAVE program. If you didn't get a chance to watch the first little video that I put, I'm going to put a link right here that you can click on, go back and watch that and get a refresher or look at it for the first time. In that video, I talk about a reminder that is the key to the whole program. That is the diabetic foot exam. What I'd like to do, I have my famous ZZ test alligator patient up here on CPRS. What I'd like to do is quickly go through that reminder with you. So let's take a look. So here we see in the reminders, there are reminders due. None of the reminders regarding PAVE are due here. They've been done on this patient extensively, and therefore they've been moved under applicable, which is foot risk and intervention. Then the diabetic foot exam, which is the one that really needs to be done. That talks about visual foot problems like hammer toes. It talks about circulation, and it talks about loss of protective foot sensation. Then you'll want to check one of these down here, and this whole thing is then placed in your note, and then you're all done, and the patient gets a foot risk score. So that's kind of how it's done. Well, that's it. It's that one reminder. There are 3 foot reminders in there, but the diabetic foot exam is the reminder that gives our veterans their foot risk score. So until next time, this is Dr. Frank Davis. Remember, we're all preventing amputation in veterans everywhere. Thank you.